Hello, my name is Scott Sherman and this is my first instructional media type options assignment. I will start this assignment by first summarizing the pre-written sections from the beginning of the text template provided to us by our professor. The pre-written section is the plan of a program that contains learning tasks for candidates to acquire the skills necessary to become effective lifeguards and earn certification for the job. Such lifeguard skills will be included: the ability to conduct a primary assessment, perform cardiopulmonary resuscitation, also known as CPR, and administer first aid. The training program is designed to help learners acquire the knowledge and skills to act swiftly and accurately in emergency situations. The certification class size is designed for 20 learners to 1 instructor. Let me briefly summarize the media selection process on how to approach this lifeguard program. The two big stages to approaching media selection are the selection of instructional methods and then the choosing the type of media that reinforces the instructional methods. Sergio and Clark in 2000 proposed that the first step of media selection is to consider a model of 6 instructional methods: goal elaboration, information, practice, monitoring, diagnosis, and adaptation. Once these 6 instructional methods are met, the second stage in the media selection process involves choosing the media that provides the best type, amount, timing, and control of methods that support the cognitive processing necessary for learning. According to Clark, Booley, and O'Neill in 2006, the 3 instructional methods that often limit instructional media selection are: 1. The sensory modes required for learning concepts, processes, and procedures; 2. Conditional knowledge requirements for the use of learned information; and 3. The need for synchronous feedback when complex knowledge is being learned. In the case of the lifeguard skills program mentioned before, I want to focus on the practice phase. The practice phase is where students will practice their conceptual and procedural knowledge by recalling the steps of a primary assessment aloud and practicing the assessment. Thus, learners will practice their knowledge by narrating aloud what they are doing and practicing various actions based on different scenarios. For instance, what to do within the primary assessment if there is a child victim versus an adult victim, or a breathing victim versus a non-breathing victim with or even without a pulse. During the action scenarios, learners will practice psychomotor skills like opening the victim's airway using the head tilt chin lift technique taught earlier in the course. In addition, learners will practice sealing the CPR mask and administering ventilations and compressions on adults and children. As an instructional designer, I came up with 3 potential media to use for the practice phase of this lifeguard skills program: a website CPR video game that lets you practice the knowledge and skills you would need to properly perform CPR, an in-person use of responsive CPR dummies. These dummies would be as realistic as possible and allow learners to practice their knowledge and skills on them. And my third media choice would be for learners to be able to enter an augmented reality to be involved in the scenario and practice their knowledge and skills as best they can in a life-like environment. Now, I want to check whether any of these 3 media options were limited during the media selection process. So I had 3 questions to check to see. The first question has to do with conceptual authenticity. The question goes: can the learning platform simulate all of the necessary conditions in the job setting where the learner will apply their skills and knowledge? The second question has to do with feedback. Can the platform provide the required immediate, synchronous, and delayed, asynchronous information and corrective feedback needed to achieve learning objectives? The third question has to do with sensory requirements. Can the platform provide the necessary sensory mode information required to achieve all learning objectives? So as mentioned before, I asked each question to the 3 media options and put a pass or fail for each as I saw fit. Let me begin by explaining my reasoning for the website CPR video game. This would be a game that gave you various scenarios and you would need to complete the task using your knowledge and skills learned from earlier parts of the course. This media type passed the conceptual authenticity question because the learner could apply the skills and knowledge learned in the course in a similar electronic environment to their job setting. The game passed immediate feedback because the game would be able to provide the learner synchronous immediate feedback as they did something right or wrong. However, there was limited opportunity for individualized feedback, which is problematic. The special sensory requirements was a fail for this media because the learner would not be able to practice their psychomotor skills any more than theoretically, and this is not good enough for CPR certification because as a practical citizen myself, I want my CPR certified lifeguards to have had at least physical practice for chest compressions and breathing rather than only hypothetically. For the in-person use of responsive CPR dummies, I gave a passing grade for each evaluation. Because the dummies require an in-person hands-on approach, the conceptual authenticity is there as long as the dummy is well constructed and is human-like. Learners would also receive synchronous immediate feedback that would be individualized by the observing instructor and or their peers. Finally, this media option would also meet the special sensory requirements because it would allow students the psychomotor skill practice on a mock human being rather than doing it just theoretically. Augmented reality also passed all three categories. However, the technology for this media is still in development, and depending on the sophistication, may work as intended or may not. It is my belief that the augmented reality would also allow for a responsive CPR dummy, a VR headset, and responsive gloves. Students would be able to display their knowledge and skills by verbally letting their instructor and peers know what they are doing as both observing parties watch on a connected TV screen. Thus, this media would pass the conceptual authenticity assessment because the media simulates the necessary conditions for the learner to apply what they know in a similar job setting. Because the instructor and peers could watch the feed of the learner, immediate synchronous feedback would be available and would also be individualized. Finally, and potentially the most controversial, the special sensory requirements. I put that the augmented reality would pass the test for special sensory requirements. Of course, this, once again, returns to the sophistication of the technology. If the response gloves let you feel the dummy and it looks like a real person through the VR, then the situation is that much more realistic, and any practice in a more realistic environment will prepare the learner for a actual real situations better than one that is not in a real environment. As a consequence of this assignment, I must eliminate one of my media options. Thus, I've elected to dismiss the website CPR video game. It was simply the weakest of the three options as it does not allow for in-person practice and thus lacks the special sensory requirements. Alright, that's it for now. Thanks for watching.